One of the big challenges, as they were just talking about, in administering this vaccine is going to getting it out to large swaths of the country, including rural areas, and getting people to take it. So joining us now to talk about that, John Felton. He's the president and CEO of Yellowstone Health in Montana, in Billings, where my daughter is currently living. So, John, I'm going to ask you, from your standpoint there, how confident are you at this point about the uptake, as they say, about people getting the vaccine, about being willing to get it, and getting it into the arms of people in Montana? What are your concerns?
Well, first of all, thanks for having me. I think the rural perspective is really important. I think there's a lot of anticipation about the vaccine. People are really banking on it. So I'm anticipating we'll have a pretty high uptake. I think the challenge in rural America is going to be the distribution system. So Montana is developing kind of a hub and spoke system where the larger communities will get doses and need to share them throughout the region. And so that takes a lot of regional planning. Fortunately, at least in our region, we're pretty good at that. We've been doing that a long time.
Well, states like Montana, Wyoming, really, you guys were originally spared mostly from the coronavirus pandemic. Recent weeks, as I follow the Billings numbers almost every day, you've seen record numbers of infections and sadly deaths as well. So how's it been inside the healthcare system there? Can you describe for us what you're witnessing?
Yeah, people are really tired. I think the general population is tired of the virus. Healthcare workers and public health workers have been working really unbelievable hours since the virus arrived in Montana back in the middle of March. And, our hospitals have a lot of patients right now. There's 2 hospitals in Billings. Today we have 145 COVID inpatients in those 2 hospitals, and about half of those are Yellowstone County residents, about half from the region, which is pretty typical for us. But of those 145, we've got 41 in the intensive care unit, 23 on ventilators. So, people have been working really hard. We've had a lot of patients. I think the other thing is, that healthcare workers aren't entirely spared from the virus as well. So we've all had to deal with our staffing challenges as well as our own staff either become ill or quarantined because they've been exposed.
Do you share Dr. Fauci's concerns about this post-Thanksgiving surge there? Do you think you talked about people being tired of the virus? Do you think Montanans and others have put themselves at risk this holiday weekend?
Yeah, I think we probably saw more gatherings and events than we would like to have seen. I do share Dr. Fauci's concerns. If we believe that history gives us insight into what's to come, we saw big increases after the Memorial Day weekend, after the 4th of July holiday, after the Labor Day weekend. So we've really been encouraging people to enjoy Thanksgiving and the later holidays in a different way. Yeah. Connect with your families, connect with your friends, but try to do it in very small groups and use technology. So our concern is just what you heard. In the next 2 to 4 weeks, we expect that we'll see another big increase in cases.
And on all these issues, on the vaccinations and on the spread of the virus itself, the country's been going through it really in this divided way, haven't we? Divided along our political and regional cultural lines. Do you see it there? Do you get a sense that there's an argument over something that really should have brought us all together to keep each other safe?
Yeah, I don't think there's any doubt, any denying that this virus has become highly politicized. What I am seeing, though, is we have orders in our community related to occupancy percentages, and the governor's issued a statewide masking mandate. The masking mandate actually goes back to July 15th, but over the last few weeks, it seems observationally that more people are wearing masks, that people are being more cautious about when they're out in public, keeping distance. So I think we're reaching the point that it is so widespread that pretty much everybody knows somebody who has either had the virus or been affected by it or has lost a family member to it. And we are seeing, I believe, better compliance. But we really tell people a lot. The vaccine looks like it's going to be great, but it's going to take time. So please don't give up on being careful until the vaccine gets here.
That's for sure. Well, thanks very much, John Felton, and good luck to the people of Yellowstone Health and Billings as well, all of them. Thanks very much.
Thank you very much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.